Hi there. Yeah, my name is Lily. I'll be your dental hygienist today. So you're already comfortable. Well, as comfortable as you can be at the dentist, right? Well, this shouldn't take too long, and it should be perfectly painless. Okay, we are just going to start with a little scaling on your teeth. If you'd open up for me, please. Thank you. Don't worry, it's a sharp tool, but it's just going to go on your teeth. I shouldn't get your gums at all. Pretty good at this. Just going to get in there with my mirror. And this is just to... So plaque is really difficult to get off once it's formed. And frequently, even if you are thoughtful about your tooth health, we get plaque up near the gums because it's hard to brush perfectly every time, you know? Now I can adjust this light. Was this too bright for you, or are you good? Okay, great. Yeah, I just need a good peek inside your mouth there. It does look to me that, like, you pretty regularly do your brushing. How many times a day do you brush? Once? I know. We always say twice, but most people don't. It is best if you do, especially if you choose after meals. But, you know, if you're brushing and flossing once a day and you're doing as thorough a job as you can, you're doing good. I am seeing a little bit of plaque buildup near your gums, especially on the upper teeth. We tend to do the worst job brushing on our dominant side because our non-dominant side is easier to get with our dominant hand. So we tend to do, if you're right-handed, your right teeth are probably going to have a little more buildup on them because we're not as good at brushing that. Oh, don't worry, it's not terrible. I've seen far worse. And that's why you come in for the cleanings. We kind of help prevent that plaque from turning into cavities, from causing cavities. It looks like the back sides of your teeth are that you're struggling to get those really well. Do you floss or do you use a water pick or like a water flosser? Okay. Oh, well, if you're using a water flosser, you need to remember to get both front and back. So you need to go up, under, and in to get that back side of your teeth, because otherwise there's going to be a bit of plaque buildup there. But it doesn't look like your x-rays had any cavities. It looks like the doctor's not even gonna be able to make time for you today. I'm sorry. But she took a quick look at your x-rays and said you have no cavities and that you just need a little bit of a cleaning, so you'll be good to go once you and I are done here. Just gonna go around behind you a little bit. Gonna move this light. Yeah, I'm just getting the bottom row right now. Yeah, you're doing great. You can, and if you start to get tired, you just let me know. You can give your mouth a break. It looks like you have a cap on this front tooth. Is that right? Okay. Another interesting thing is you seem to have a baby tooth that has never that never grew in an adult tooth. That's funny. I have one of those too, actually. I'm constantly worrying about it because, you know, on baby teeth, the roots aren't as strong. And so if they get cavities and need drilling, they're more likely to need to get pulled. So you gotta take extra good care of that baby tooth. Just in front of you a little bit here. Well, thankfully the baby tooth is on your non-dominant side. So it looks like you're taking fairly good care of it. Oh, don't worry. It's nothing I haven't seen before. I used to love going to the dentist when I was a kid. Because I was such a good girl, you know, I took good care of my teeth, and someone paid nice attention to me and told me I was good for 30 minutes. It was wonderful. And then when I got to be a teenager, I started getting cavities like crazy. I chewed on things I shouldn't have chewed on when I was a kid. A little bit of pica, and I would chew and eat metal and plastic and that kind of thing, and it wore all the enamel off my teeth. And by the time I was a teenager, I just started getting cavity after cavity, even if I was taking good care of my teeth. So I hated going to the dentist because they kept telling me I was a bad girl, and I hated it. I mean, they never said those words, but, you know. But some people are really scared of the dentist. And I don't know if it's... I don't know if it's having somebody pay that much attention to them, or they're afraid that their teeth aren't well, or if it's they're afraid of pain, you know. Some people have very sensitive mouths, and even just gentle scaling can be horrifying for them. And we cater to those kinds of people here. We can take extra long to make sure we do everything with the utmost precision and care, so they don't feel any pain, or that we can put them at ease. Because dental hygiene is really important. You know, if you want to live a good long life, it'd be nice to have your teeth the whole time, right? Well, there's lots of, if I understood you right, sorry, it's a little hard to understand you with your mouth open. There's a lot of things you can do that aren't just brush and floss your teeth. Your diet plays a huge, huge role in how your teeth health is. Yeah, and funnily enough, people are like, well, don't eat sugar, but that's not the only thing. Carbs are sugar. They turn to sugar in our bodies, and carbs can have just as difficult or just as dangerous an effect on your teeth as just straight up sugar does. If you eat more frequently, that can have a negative effect on your teeth, because if you eat, say, 6 meals, little meals a day, as opposed to 3 meals a day, that's going to be longer before your saliva washes away the food, and it's going to be sitting on your teeth, causing plaque or cavities. Or so the kinds of things we eat, when we choose to brush, and then, you know, like in my case, don't chew on crap you shouldn't be chewing on. That, you know, we can wear away our enamel. People who clench or grind in their sleep. That's a huge one. I'm also one of those, so I had a double whammy going on. I didn't get a night guard till I was like 37, because I didn't realize I was clenching in my sleep. And even if you don't grind, just clenching can have the potential to crack your teeth. But I finally figured out one morning. I woke up and my tongue was bloody because my tongue had slipped between my teeth, and I have a jagged front tooth from chipping it on a swing when I was a kid. So I was like, well, crap, I guess I need a night guard. Although honestly, like, we're gonna try to sell you a night guard if you're a clencher, and it's like $400. The ones from the store are pretty good. Like the $20 ones, they're pretty good. Just go for those. Don't tell the doctor I told you that. You're almost done. You had quite a bit of plaque on the back sides of your teeth, like I said, and I had this problem too. You're going to want to make sure that you are turning your water pick around and going up inside your mouth, getting the back sides, and make sure you get all the way to the back, because you've got a couple wisdom teeth in there. It looks like you chose not to come out, which is great. If you don't have to get your wisdom teeth out, you shouldn't, because it's traumatizing to your mouth, and there's a lot of things that could be difficult about it. So there's no reason to pull teeth if you don't need to pull teeth. But that does mean that they require a lot of extra care. So, and if you don't care for them, there's a chance we'll need to pull them anyway. So, alright. We're just about done here. And then we're going to go ahead and I'm going to floss for you, okay? And I know that seems silly because most people that are adults know how to floss. But we do it anyway before the polishing. I'm going to go ahead and polish. That's going to just make your teeth healthy and help them resist some resistant plaque in the future. Doing great. Do you need a break for your mouth? Here. Just open and close a little bit. Yeah, smile, frown, move your mouth. Okay. You good? Alright. Yeah, no problem. We actually schedule a little extra time at this clinic since we cater to especially to people who have a phobia of dentists. For all of our appointments, we give extra time, so you stay as relaxed as possible, okay? Looks like this bicuspid needs a little more work. I'm trying to get up close to your gums without hurting you. Please let me know if I'm failing at that. Oh, I just love having my office by a bunch of windows. Okay. That's great, hon. Okay. We are going to do a little bit of dental floss. If you could open up for me. Thank you. Oh, it was a little tough. I'm gonna go back in that one real quick. Yeah. Did you get a filling on that one? Was it from us? Okay. Because it's awfully close. Yeah, well, the proper way to do it is make sure you rub along both sides. So you go in like this and rub and pull out, and then frequently you'll need to move to a different part of your floss because there'll be gross stuff on it. Once we got the plaque off between your teeth is very good. You are obviously flossing regularly. It just seems like you're missing back behind those teeth. Okay. Very good. I'm just going to do a little manual inspection, make sure we got everything. Just going to double check. So in the x-ray you had a couple spots. They're not cavities, and if you keep an eye on them, they should not develop into cavities if you're, careful with your care for them. Yes. And actually, we sell a recalcification toothpaste here. And again, don't tell the doctor that I'm telling you, but you can buy a recalcification toothpaste on Amazon for cheaper than we sell it here. Quite a bit cheaper. So maybe consider that, because those spots, you can actually re-harden those spots with the proper care. Okay, can you open up? Yeah, and then turn a little bit this way. Thank you. Yeah, just want to make sure that every spot No, we shouldn't need to do a fluoride treatment today. As soon as I'm done just checking and inspecting here, yeah, it looks like we missed a spot right not at the a little bit of plaque. It's like I like to go in a second time because sometimes the polish reveals all. Okay. And you did mention on your questionnaire that you're having a little bit of jaw pain. The x-ray didn't really come back with anything for that. It could be the clenching. Just a second. Okay, I'm going to just do a little feeling around your face and jaw really quickly and make sure there isn't anything that stands out. With the clenching, we do, like I said, we will mold you a custom night guard. I'm just gonna get the back of your head here, sorry. Yeah, so we can mold you a custom night guard. And that's something you can make an appointment for, or you can mold yourself. You can mold one for yourself, and it's pretty effective. You usually just you put it in a pot of boiling water and then mold it to your teeth, usually your upper teeth. Yeah, nothing seems serious about that. It just looks like there's a little bit of damage to the tops of your teeth, or the planes of your teeth that clench together, which probably is from mild clenching. And it's not a huge problem right now, but it could become a big problem in the future, so it's something you're going to want to watch out for. Okay, so let's see, I've got a couple options for you. You can have green or blue. They look almost exactly the same, right? Okay. And I've got some Colgate for you, because Colgate gives us these samples so that we'll hook you guys on Colgate. And I'm going to give you also some Colgate floss. Now, I know a lot of people buy the packs from Costco. Those Glide packs, those are not good. Do not use them. They don't have enough grip on them to actually pull stuff out of your teeth. So they just go between your teeth and slide around and don't actually pull any of the plaque off. So you're going to want to use something that has grippiness to it, okay? Alright, I'll put these all in a bag for you. And you are good to go. It was really nice to meet you. Take good care of your teeth, and I'll see you in 6 months.